Have you ever heard of Fabry disease? Most people haven't, but for those living with it or caring for someone who is, it can be life-changing. This rare, inherited disorder may quietly damage organs for years before anyone realizes something is wrong. Its symptoms often start small, like burning feet or heat sensitivity, and build up silently until serious problems emerge in the heart, kidneys, or brain. In today's video, we'll walk you through the symptoms of Fabry disease, what to look for in children, adults, and seniors, and why early awareness is so important. Let's dive in. Section number 1, what is Fabry disease? Fabry disease is a rare genetic condition that affects how the body breaks down certain fats. It happens when the body lacks a key enzyme called alpha-galactosidase A. Without this enzyme, a fatty substance called GL3 or globotriacylceramide builds up in the cells, especially in the heart, kidneys, skin, nervous system, and blood vessels. Over time, this buildup leads to serious damage. The disease is passed down through families, and because it's linked to the X chromosome, it tends to affect males more severely. But women can absolutely experience symptoms too, and sometimes just as intensely. Let's look at how these symptoms begin. Section number 2, early symptoms. The first warning signs. Most people with Fabry disease start to show signs in childhood or adolescence, often long before a diagnosis is made. Here are the early signs to watch for. Burning pain in the hands and feet. This is one of the earliest red flags. Kids may complain of shooting or burning pain, especially during fevers or after exercise. Heat and cold intolerance. People with Fabry may struggle with hot weather or cold rooms. Their body just can't regulate temperature properly. Little or no sweating. Known as hypohidrosis, this lack of sweat can make heat even harder to tolerate and is often overlooked. Angiokeratomas. These are small, dark red or purple skin spots. They typically show up in clusters on the lower trunk or groin area. Cloudiness in the eye. Doctors call it corneal verticillata. It doesn't affect vision, but is a key clue during eye exams. Gastrointestinal discomfort. Stomach pain, cramping, and frequent diarrhea are common, especially in children and teens. Fatigue and growth delays. Children may fall behind on the growth curve and feel constantly tired, even when they've had plenty of rest. These symptoms might not seem connected at first, which is why Fabry is often misdiagnosed as something else, or missed entirely. Section number 3, adult symptoms, when the damage grows. As people with Fabry disease age, the damage caused by fat buildup starts to show more clearly, especially if the condition goes untreated. Here's what can happen in adulthood. Kidney damage. Protein starts leaking into the urine. Over time, this can lead to kidney failure, requiring dialysis or transplant. Heart problems. The heart muscle thickens, a condition called left ventricular hypertrophy. This makes the heart work harder and increases the risk of heart failure or irregular rhythms. Strokes. Even in people under 40, strokes can occur. Sometimes they're small and go unnoticed, but the risk is serious. Hearing issues. Tinnitus or sudden hearing loss may develop. Fatigue worsens. It's not just tiredness. It's a deep, chronic exhaustion that affects daily life. Shortness of breath. The combination of heart and lung stress can make even mild activity feel overwhelming. These aren't just mild inconveniences. They're signs of real, ongoing organ damage. The sooner they're recognized, the better the outcome. Section number 4, symptoms in women, the overlooked reality. There's a common myth that Fabry disease only affects men. The truth is, women are often affected too, but their symptoms can be more subtle or appear later in life. Because women have 2 X chromosomes, one healthy copy of the gene may partially make up for the faulty one, but not always. Women may experience unexplained pain, severe fatigue, digestive troubles, heart issues, stroke. Sadly, women are more likely to be misdiagnosed or dismissed, even when they're showing textbook symptoms of Fabry disease. Section number 5, the danger of delayed diagnosis. Fabry disease often goes undiagnosed for 10 to 15 years from the first symptom. Why? Because the symptoms mimic other common problems, like growing pains, IBS, or just getting older. Many doctors aren't trained to recognize Fabry because it's so rare. But left untreated, the disease can lead to organ failure, disability, and early death. That's why early detection is critical. Blood tests, enzyme tests, and genetic testing can confirm the diagnosis, and there are effective treatments available, including enzyme replacement therapy and newer oral options. Section number 6. What to do if you suspect Fabry. If you or someone you care about has unexplained symptoms, especially a combination of nerve pain, heat sensitivity, fatigue, and family history, speak to a specialist. Ask your doctor about a genetic consultation, blood, or enzyme testing, family screening. Fabry may be rare, but when it runs in families, multiple generations could be affected without ever knowing why they're always tired, sick, or in pain. Knowledge really is power here. Fabry disease is often silent at first, but it doesn't have to stay invisible. With awareness, testing, and treatment, people with Fabry can live longer, healthier lives. If you found this video helpful, give it a thumbs up and share it with someone who might need this information. And don't forget to subscribe for more health wisdom, especially focused on rare conditions and aging well. Thank you for watching, and stay informed, stay proactive, and take care of yourself.